Evaluation approach. Evaluation is a systematic assessment of the design, implementation, and outcomes of an intervention. For a major program of change such as the HTP, it is essential that comprehensive, robust, and proportionate evaluation is undertaken to ensure the program is delivering positive outcomes and value for money. The content of this strategy utilizes evaluation guidance from the Green Book and Magenta Book and builds on the DWP evaluation strategy, which sets out the approach for ensuring that DWP evaluations deliver high-quality evidence on the right questions at the right time. We are drawing on advice from other major DWP programs and cross-government experts to build a program of evaluation and monitoring which supports the agile nature of the HTP across the life of the program. As well as the work detailed in this document, our evaluation strategy will be complemented by ongoing day-to-day learning and iterating that forms an integral part of an agile program. This will include the insights and learning that we collect as part of our usual processes, such as that undertaken by user researchers, digital service designers and business analysts. Evaluation aims. The evaluation of the HTP will develop over the life of the program to incrementally build a picture of the context, influencing factors and levers which relate to the outcomes of the HTP as set out in the Strategic Outcomes (TOC) and Program Business Case. How successful the HTP interventions are at achieving these outcomes and delivering on the HTP's business case. The evaluation will provide evidence to inform the HTP's decision-making and support the DWP's wider health and disability strategic outcomes. The core principles of the evaluation are to establish a robust and detailed evidence base to inform decisions about service improvements and how the HTP can drive better customer experience. Provide person-centered insight on what works for whom to ensure a broad range of needs are considered when transforming our services. Provide assurance that the business case has been met. The remainder of this strategy will describe how the evaluation will deliver on these aims and principles. Evaluating an agile and evolving program. The HTP evaluation will align to the agile approach to design and delivery in the program. We have developed an evaluation approach which ensures we are consistently providing timely evidence and iterating our learning plans to feed into key decisions across the life cycle of the program, not just at the end. This approach facilitates evidence-based decisions and allows the program to adjust direction where necessary, based on up-to-date evidence. To deliver this approach, our evaluation strategy works across 4 layers interchangeably. Figure 1. Planning and scoping, cross-cutting insight, test and learn, evaluation of services. End of Figure 1. Planning and scoping. The planning and scoping layer ensures that we are developing and iterating our evaluation approach with consistent principles and understanding. This involves developing a TOC. See the section on Theory of Change that sets out the vision for the HTP by describing the inputs it can change, the mechanisms it can use to bring about the desired change, and the outcomes it is aiming to achieve. Iterating an evaluation strategy that provides a clear forward-looking evidence plan. Working with delivery teams to understand emerging evidence needs. Cross-cutting insight. The cross-cutting insight layer ensures that we are continuously learning about the context, levers and influencing factors that relate to the HTP. This involves conducting research about a broad range of issues that affect our customers and services to fill evidence gaps and provide up-to-date learning. See the section on Test and Learn strategy reporting against a set of performance and results indicators to build a picture of whether the program is achieving what it set out to achieve. See the section on Data Sources. Test and Learn. The test and learn layer ensures that when we test new ideas, we are testing the right things at the right times and feeding the learning into program feedback loops to influence design and delivery decisions. See the section on evaluation of services. This involves designing a process for logging, prioritizing, and scoping new ideas for testing. Implementing tests that build our understanding of new ideas whilst protecting customers and staff. Ensuring we get robust learning from our tests by implementing proportionate evaluation and reporting. Evaluation of services. The evaluation of services layer ensures that, as services develop, we can understand to what extent the HTP has successfully achieved its outcomes. See the section on measuring performance. This involves conducting ongoing evaluation work which will scale as the program scales to give an indication of impacts and the effectiveness of delivery, and inform key decisions. As required, evaluation activity will include impact evaluations which tell us what effect the service has on customers and outcomes. Process evaluations which tell us whether the delivery of the service is successful and sustainable over time. Value for money assessments which tell us if the service delivers good use of taxpayer money and delivers on the business case set out for the HTP. It is important to note that the strands of work in the HTP will not move linearly across these 4 layers but will move back and forth between layers as we build the evidence base about what works. For example, we might undertake some evaluation and then move back to test some new initiatives based on what we learned.